Hello YouTube, without pain, long recovery and anesthesia, how to quickly cure varicose veins. This technology is effective, safe, fast and convenient, since the treatment is carried out on an outpatient basis and does not require special preparation from the patient. Phlebotomist, vascular surgeon talks about the modern method of treating varicose veins, glue. The expression "there is no limit to perfection" also applies to modern phlebology, because the revolutionary, endovessel, methods of treating varicose veins have not yet reached the optimal level, as specialists have already begun to develop and put into practice completely different technologies. We can say that the future is entering our daily life with a victorious gait, because today almost no one remembers those ordinary traumatic and terrible operations that have been used to treat varicose veins for 2 centuries. Important and progressive characteristics of modern phlebology are the pursuit of excellence, simplification of intervention, reduction of surgical trauma, minimization of side effects, complications and reduction of recovery time. And the closest to the ideal is ablative therapy with cyanoacrylate, glue, which belongs to the latest generation of treatment methods, non-thermal and non-tumescent. That is, during these techniques there is no thermal effect on the veins, and anesthesia is not needed at all to perform the operation, only one small injection of local anesthetic at the vein puncture site on the lower leg. This treatment technology is also called adhesive obliteration. It is easy to apply and gives a good result. This is not a new technology, it is widely used in routine practice by specialists around the world, has a significant evidence base for efficacy, safety and positive patient feedback. Also, one of the important features of the procedure is that it reduces the likelihood of nerve damage, that is, the undesirable consequences of thermal interventions. This technology is fully consistent with the principle of the so-called office surgery, that is, the patient came to the clinic at lunchtime, had surgery and went back to work, without any restrictions. Doctors don't just talk about the varicose scourge in the world. Up to 40% of women and 20% of men are affected by this disease, and its symptoms can appear as early as adolescence. We tell you the most important thing you need to know about varicose veins: treatment, possible complications, symptoms and preventive measures. What is varicose veins? The diagnosis of varicose veins means the deformation of the veins, in which the walls become thinner and the lumen in the vessels increases. How does this happen? Normally, blood flows upwards through the veins, and special valves prevent the liquid from flowing down under gravity. They open, letting blood through, and close, not letting it back. If the valves do not work well, part of the blood still drains and stagnates. Its volume in a certain part of the vessels increases and creates pressure on the walls. As a result, the vessels are stretched, varicose veins appear. Most often, the veins on the legs crawl out. However, varicose veins can affect not only the lower, but also the upper limbs, abdomen, groin and other parts of the body. Causes of varicose veins. A number of factors can contribute to the development of varicose veins. Some of them, with a strong desire, can be excluded from life, thereby reducing the risk of encountering a disease. Overweight, obesity, helps to increase the load on the legs. Unbalanced nutrition. Lack of fiber leads to constipation, which increases blood pressure in the pelvis and provokes problems with the veins in the legs. Long static loads. Dangerous sedentary and standing lifestyle, weightlifting. On the other hand, some factors are beyond the control of man. However, you can keep your weak points under control, carry out prevention, know how to treat leg veins, and undergo diagnostics in a timely manner. Genetic predisposition. The probability of getting varicose veins as a legacy from a mother or father suffering from this disease is very high, up to 90%. Vascular injuries and operations. They can negatively affect the operation of valves, weaken blood vessels, Age. The older the person, the weaker the vessels and the greater the tendency to varicose veins. What is dangerous varicose veins? Heaviness, swelling, pain with advanced varicose veins become constant companions of a person and significantly reduce the quality of life. Due to stagnation of blood, the nutrition of the skin is disturbed, which leads to skin pathologies, cellulite, trophic ulcers, and thrombophlebitis, inflammation of the veins. The most dangerous cause of problems with blood vessels is thromboembolism, or blockage of blood vessels with dense blood clots. Blood clots stick to the walls of the veins and narrow the lumen, or, in the worst case, break off, enter the circulating blood and clog the vessels. Depending on the site of blockage, thromboembolism can lead to stroke, myocardial infarction, kidney or spleen infarction, tissue ischemia with the threat of subsequent gangrene. It is important to understand that the disease develops gradually. Having discovered minor symptoms, veins on the legs swelled, there are occasional edemas, it is not necessary to run headlong to the hospital and lie down on the surgeon's table. But it is also impossible to put it off until some time later, since it is much easier to neutralize the disease in the early stages, and without treatment it will only progress. A bit of history. Superglue is one of the most famous and widely used adhesives in various industries. This little assistant has positively established itself in the market of the modern world. It is indispensable when you need to quickly and firmly fix, glue something, not only in everyday life, but also in medicine. The substance that forms the basis of all superglues was discovered twice, and the same person did it, Dr. Harry Coover. In 1942, he studied cyanoacrylates, while the Second World War was going on and a transparent polymer was needed for small arms sights. Unfortunately for Coover, cyanoacrylates were not suitable for this purpose, and in general they were very difficult to work with. However, as a result of many years of experiments and attempts, the product nevertheless saw the light under the name Mixture 910. The glue was first used for medical purposes during the Vietnam War as a spray to temporarily stop the bleeding of the internal organs of wounded soldiers before routine surgery. What is the essence of adhesive obliteration? The adhesive obliteration technique involves the introduction of a special glue into the affected vein using a syringe and a catheter, which glues it almost instantly. Injection into the lumen of the vein, when combined with blood, causes the polymerization of the glue, resulting in occlusion, complete gluing, of the vein. In medicine, cyanoacrylates have been used for a very long time and in many areas, for example, neurosurgery, military medicine, endoscopy, ophthalmology, dentistry, cosmetology, plastic surgery, general surgery, vascular and cardiac surgery, thoracic surgery, urology, gynecology, orthopedics and the production of medical equipment. Therefore, adhesive obliteration is the next revolutionary step in the development of modern phlebology. This technology is effective, safe, fast and convenient, since the treatment is carried out on an outpatient basis and does not require special preparation from the patient. It lasts from 10 to 30 minutes. Benefits of treatment technology. The procedure is painless and comfortable for the patient. The doctor uses local anesthesia only at the puncture site through which the catheter is inserted, one injection. There are no incisions and surgical actions of a traumatic nature. This technique is not a thermal type of surgical intervention, therefore there is no risk of hemorrhage and damage to nerve fibers with loss of skin sensitivity. No need for general anesthesia. There is no need even for short-term wearing of compression underwear. Quite safe. Does not require dressing and active post-operative care. The patient returns home on the day of the procedure. The patient can immediately return to everyday life. Normal activities can be done literally in a matter of hours. According to scientists, this method solves not only the problem of vein treatment itself, but is also a preventive measure. is the method of choice in age-related patients, as well as in the initial forms of the disease. Prevention. In order not to have to become a regular patient of a phlebotomist and learn how to treat varicose veins on the legs, you need to follow simple and affordable preventive measures. The main method of preventing the disease is moderate exercise, especially walking, swimming and cycling. Proper nutrition is equally important: less flour and fat, more vegetables, herbs, foods high in vitamin Z, C and P. You also need to develop good habits. Do not sit with your legs crossed, give up high heels and close squeezing your body, do physical exercises between sedentary work, keep the water balance, minimize the use of alcohol, coffee and strong tea, and exclude smoking. Thank you for your time and attention listening to me. Don't forget to hit the like button and subscribe to our channel. You can also click the bell sign to be informed about new videos. Have a great day.